I'm Dr. Andree Jones. I'm a primary care sports medicine specialist with District Medical Group, and we're talking about heat-related illness today. This can be anything mild from heat cramps to more severe like heat exhaustion, and in an emergency situation, heat stroke. Kids are getting back to practice, and so we want to be aware of this as kids are more likely to suffer heat-related illness. And this is because they have increased heat gain compared to adults. They have less ability to sweat, and then they are also, they have less urge to drink, and so that increases the risk of dehydration. Now, it's important to know the symptoms of this. They can be mild, such as headache, nausea, or vomiting. More serious would be heat exhaustion, where you physically are unable to continue exercise because you feel so poorly. And the worst case scenario is heat stroke, which is a medical emergency. And that would include confusion and loss of consciousness. So it's important to prevent this. The number one way to prevent it would be hydration. Young kids, ages 9 to 12, need to be drinking 3 to 8 ounces every 20 minutes during activity, and adolescents and older need to be drinking 1 liter to 1.5 liters per hour during activities. You want to make sure that you're taking frequent breaks while you're working out, and you want to be able to cool yourself off during those breaks, whether that's shade, air conditioning, or a fan. And if you do start to feel poorly, the treatment of this is to get yourself cooled off. So go inside, drink, take a rest. If you do have heat stroke or severe heat exhaustion, the treatment of that is ice water immersion, and heat stroke is a medical emergency. If you do suffer these conditions, it is important to get medical clearance before you go back to activities. Keep this in mind. Increase your hydration status, take frequent breaks, and get yourself used to the heat if you're just starting to work out. This is one of the leading causes of death in high school athletes, so make sure you're addressing the symptoms of heat-related illness.